Angela Cascio is the infectious disease director with the South Dakota Department of Health, and she says syphilis cases have sharply risen since 2021 in South Dakota and nationwide.
It has continued to increase since that time, both nationally and in South Dakota and in surrounding states. We're currently experiencing over a 2,100% increase over our 5 year median baseline.
Cascio says the main age group being affected are those between the ages of 25 and 49.
The age range of 25 to 49 is our age range that we're seeing primarily infected. And we do have cases, under the age of 25 and over the age of 49, but primarily within that age group. It could look like maybe just a little pimple, a little herpes. Maybe a lot of people mistake that for a herpes infection.
And then the signs and symptoms vanish, but the disease is still in your body for a lifetime if unchecked, and that can lead to serious health problems in the future.
It's not producing any symptoms. People don't think there's anything to be concerned about. And then later on, it can be 10, 20 years later, there are manifestations that can occur. And most of those are neurological in nature.
Cascio says the best way to prevent STIs like syphilis is to be open with your healthcare providers, along with getting tested and practicing safe sex.
So if you are sexually active, you need to be practicing safe sex. The other key piece is testing. Anyone who is sexually active should be testing themselves, and not just for syphilis. I mean, we're seeing a rise in all sexually transmitted infections, so they should be testing themselves for all sexually transmitted infections.
And if someone does test positive for syphilis, it is important to talk to a healthcare provider for treatment.
The treatment is very easy. It's a shot. It can be up to 3 shots depending on the stage, but if you catch it early, you can go in, see your healthcare provider, and receive 1 shot.
And notify any partners to have them tested and treated to mitigate the spread.
And then also to notify any partners that you've been with that they could be at risk, and it's important for them to receive preventative treatment and testing as well.